I'm Dr. Waleed Azza. I am an orthopedic surgeon here at Clinch Valley Medical Center, and we are demonstrating today a total knee replacement using robotic technology. The robot is basically an instrument that helps us position the prosthesis in the best possible way and also align the knee after surgery to balance the ligaments as best we can. The robot gives us a much more accurate way of doing those two things: alignment, positioning of the prosthesis, and ligament balance to give you the best outcome of the surgery. The patient sits in the table here, and before we actually do the operation, we open the knee, look inside, make sure everything is okay, and we place these two markers that you can see here and here that will be identified by the robot camera, which is over there. And everything that we do is going to be shown up in the screen. And prior to starting, we need to tell the robot where the hip center is and where the knee center is and where the ankle center is. And then the robot will determine the alignment and all the measurements that we need to do with surgery. So the first thing we do is we rotate the leg. So as we rotate the hip joint, the robotic measuring device tells us where that center is. The next step we do is we determine certain points in the knee so that the robot knows where the anatomic position is. So, and the next step, we measure the flexion of the knee with this device, place it inside the knee, and that measures the flexion. The next step, we're gonna measure the anterior portion of the knee by looking at the places that the robot wants me to measure. This takes about 5 to 10 minutes to get all these points, and you can see on the monitor over there the measurements. This is the lateral femoral condyle and the points at the surface of the lateral side and the anterior portion of the knee. And now we are going to determine what the ankle position is. Okay, after we finish that, we are going to determine the position of the tibia, the outer surface of the knee. And these are different points that the computer needs to calculate the mechanical alignment of the knee. Okay, so that took about a few minutes. At this point, we have a graphical representation of the flexion, extension, alignment. And you can see here 0 is neutral alignment, that's straight alignment. Normal knees usually go into about valgus, about 5 degrees of valgus. And this knee is abnormal, of course. It's about 5 degrees of varus on the other side. So we are going to determine now the ligament, the two ligaments in the knee. As you can see here, I'm going to flex it, extend it, and it's going to tell me what the extension is, what the flexion is. And then, if you could just look at the monitor there, it's going to tell me how stretchable this knee is. You can see here, of course, this is not a true patient, and we can determine the flexion, extension, ligament laxity. This is an extension. We can see how lax this knee is. We can bend it to 90 degrees, flex it about 90 degrees, and then we can also determine how the knee laxity is in flexion. And this is something we cannot really appreciate without the robot, because the robot gives us numbers about exactly what the true laxity. So this is a picture that we have before we start cutting to place the prosthesis. In this representation, it tells us that if we cut the femur 9 millimeters on this side, 10 millimeters on that side, and if we cut the tibia 6 millimeters on this side, 10 millimeters on this side, that will give us a neutral alignment. And the prosthesis, we can change the flexion extension of the prosthesis or the slope of the cut in the tibia to give us the best result. So what's the next step? Well, let's go and balance the knee. Now, with this step, it tells us that if we choose these numbers, the knee in extension is going to give us a 26 on this side, 27 on this side millimeters of thickness. This is the thickness that we need to accommodate with the plastic that we are going to put in. If we put a thicker plastic, things will be tighter. If we put a thinner plastic, things will be looser. And let's look at it in flexion. In flexion, the numbers are less here, which tells me that this knee, if we cut it this way, it will be tighter in flexion. And we haven't done any cuts yet. We're just determining if we choose these levels of cuts, what the knee laxity is going to be in flexion and extension. And I know that I need to do some adjustment here so that these final numbers, 21, 22, will be close to the numbers in extension. So I'm going to, in this case, anteriorize the cut, put the cut a little bit more anterior. Let's increase the stylus on the femur. Okay, as you can see, this number is going up a little bit now. We're getting closer to that 26 and 27. Let's anteriorize it just a little bit more, 1.5. Okay, and at this point, what we need to do is make the distal cut on the femur more distal. Let's go look at the extension. It's getting close together, these two numbers. So let's distalize the femoral cut. I want to take, no, I want to take less distal femur. Okay, make it another half. Okay, so now we are in extension. This is 25 and 25 and a half, and we can look at inflection, and it's 24 and 32, 23 and a half on this side. It's getting very close together. Let's distalize the distal femur a little bit more. Okay, that's a half. So now the extension is 24 and 25, and inflection is 24 and 23. So why don't we add a half more? Yeah, that's distal femur. So now it's 24 and 24 and a half. Let's look at flexion. It's 24 and 23 and a half. So now we have balanced this knee, the ligaments, both in flexion and extension. This is something we cannot do without the robotic surgery. At this point, I'm happy with determining the cuts. All those numbers that we have finally put in place will be translated to the robot. So now the robot knows where to do the cuts for us. Okay, so at this point we have the numbers that we wanted, and we're gonna tell the computer, go ahead, I accept these numbers, I like the alignment, I like the ligament balance, and we're gonna ask the robot to assist us in cutting the femur and the tibia to put the prosthesis. Go ahead.
Okay, come to the femur.
Come to the femur. And now the robot is going to, according to the numbers that I gave the robotic computer, it's going to tell us, it's going to position this cutting guide to the right measurement, to the right place. So I'm going to assist the robot in coming down here. And when I'm happy with this, I'm going to put 2 pins in here to lock this cutting guide on the femur. I'm going to use the saw blade, and there are slots in here, and I'm going to cut the bone at that level. And when I'm done, I'll take the pins out, and we are going to ask the robot to assist us in the next cut. And this is what we did. We kind of cut this end here. And the robot will come down and tell us where to cut the tibia. We're gonna put it here, and we're gonna again put 2 pins to hold it in place. And this slot will be used to cut the tibia. And after we finish, we take the pins out, we take the robot out of the way. The robot's gonna leave us. Yeah, go ahead. And the last cut is going to be the anterior cut. Again, we put the pins, and you use this slot to.
Just remember, we have a cutting block at this point. This is where we're just drilling the holes.
Okay. So we put these holes in, and these holes will mark the position for the cutting block. We take the pins out, take the robot out of the way, and basically we're done. We have cutting blocks for the same size. We'll put the cutting blocks in the holes that we made, and we do the rest of the cut. And that's it. So the robot gave us the cuts that we needed to produce the right balance and right ligament balance before we did the cuts. And that's what the advantage of the robot is. Before we actually did the cutting, when we did this measurements, the robot has already figured out what size prosthesis for the femur, which was size 9, and what size tibia, and the thickness of the plastic. Now, of course, we can change that, especially the thickness of the spacer, the plastic. If you use a thicker spacer, as I'm gonna just demonstrate here. If I use a 12 millimeter, it will make the knee feels tighter. But that's something right at the end of surgery, I'm going to have that feeling when I test the knee after we finish, whether the right thickness that the robot chose was appropriate. And I can always change that. So the robot is not actually doing the surgery. The robot is positioning the cuts according to the alignment that we see and according to the ligaments that we see. And after we finish, we can retest the knee to see how far the alignment and the tensioning is from before surgery. And of course, this is sort of like after we do the surgery, we can retest the knee and see how tight it is. And if it's loose, we will probably use a thicker plastic. And if it's too tight, which probably never happens with this operation, the robot is very, very accurate. And I never, in all the surgeries I've done, I had to go to a thinner plastic because it's always the right tightness. But if I feel like there's a little bit more slack, then I will use a thicker plastic, which will make the knee more tight, both in flexion and extension. And then we just remove these things. It takes a few minutes to just remove these pins and close up the knee. Thank you for watching this. And if you have any questions, you can leave your questions on the website and they can relay that to me and I will respond to you.